Hi, welcome to the show. I've got three great guests today. The first two is a couple that work with couples in wanting to enrich and get back into their intimacy after they've raised their children. And the second guest, Leanne, who's going to help us to understand about healthy promotion of sexual activity. You're not going to want to miss it. We'll be right back. Hi, welcome back to the show. And today I have a married couple, Louise Dorfman and her husband, David Rubenstein. And they practice and help couples enrich their sex lives after the kids have been raised and out of the house, and things can get kind of sparky and sexy again. So just give me an overview on what you guys do when couples are coming to you and they get more creative when the kids are gone. Let's say they can start playing around at the house a little bit more, use other things in the house other than eating at the kitchen table. You use the kitchen table maybe for sex. Like, just tell me how you can get more creative with guiding couples into their sexy again after the kids have been gone. Where did they get playful?
Yeah, our focus is on helping couples connect more deeply.
Okay.
Whether they're in the bedroom or not.
Right.
If they're feeling close emotionally, if they're feeling their partner is really with them, then it doesn't matter where they're having sex. They're going to be relaxed and feel it's a really bonding, important moment for them. It's intimacy at its most.
Right.
But it begins outside the bedroom.
Right.
I think just to add to that, one of the issues for couples when kids leave is just looking at their relationship more closely, because
Right.
if they've had a relationship where it's been very kid focused,
Yep.
then they're not used to putting the focus back on each other.
Right.
So part of the transition is to help them refocus the purpose of the relationship. What are they all about?
Right.
How much energy have they put on each other and themselves?
Right.
And help them begin that process of saying, "You're the most important person to me now. Now what do we do?"
Do you find during the process of raising kids, and when you have couples come to you, do you find that they've lost knowing each other sexually? I mean, they've just gone through the motions, and it's just, they do it just to keep the marriage together. I mean, there's still a loving, caring, emotional feeling, but they've actually lost touch with the sexuality of what each other liked, because everything was warp speed and they were just going so, through the motions of, okay, dinner, okay, now we're going to have like 5 minutes for sex. Like, do you find that they get to know each other all over again?
Yeah,
sexually?
I find they don't really take those 5 minutes for sex because they're very busy with the children, and these days, as well as full-time work for most people, at the end of the day, they're taking their kids to one activity after another, and there's dinner somehow is squished in between. They're so tired at the end of the day that they're not even wanting sex or thinking about it.
So what can you guide and mentor couples to actually have the energy at the end of the day? What kind of exercises can you
Well, one of the things
implement?
that you could do is, again, in this transition phase, is talk to them about how, for example, start off with small steps. How do they greet each other?
It is a transition, isn't it?
It is a transition.
Yeah, it's
Yeah.
like...
Especially if they've been so children focused. So, for example, one of the things that we ask our couples is how do you wake up together? How do you go to bed together? What kind of rituals do you have when you're waking up, when
Right.
you're going to bed? Do you ever put each other to bed, for example,
Right.
in a kind of a metaphorical way?
Right.
And so they begin to think about these rituals and trying to implement them on a daily basis.
Create ceremonial
Exactly.
ceremonial sex.
Well, it's a matter of moments in time
Right.
that are lost. So if you take a moment just to sit face to face with your partner and
Right.
look him in the eye or look her in the eye and just see who's there.
Yeah, take the time just
Yeah.
to look.
It's almost like a meditation. It's a feeling of there's another human being living and breathing here, and you start to look deep inside and you can tell each other a little bit more about what you feel. That's pretty sexy in itself.
It is.
I mean, you can even have conversations around, outside the bedroom about what you feel like sexually.
Right.
Most couples don't have that kind of conversation. that kind of
Conversations to do with sex.
Yeah, just talk. That could itself could be kind of, especially if it's in a safe environment where you're not challenging each other, you're not competing about, you're not blaming or anything. You just.
Do you find that couples lose touch of who their partner actually is when, like, all of a sudden I know my parents, when we were all gone and it was just my mom and dad, it was like they didn't know each other because they just worked so hard running a business and raising kids, and it's like, they're like, who are you?
Yeah.
Oh, absolutely.
So is that a scary element sometimes? Sometimes can it
Well,
make
going
people
to bed with
go
a
different
stranger might
directions?
be a scary situation.
Well, this is the thing.
So,
to get reacquainted
yeah,
with your partner
yeah.
all over again.
Yeah.
You know,
What
it
kind of-
has to do with really being clearer about why are we together? What's the purpose of us being in a relationship? What's it all about?
Right.
And most of us don't have that discussion.
Right.
Even if, even if the kids are there, the kids leave. So in our work, we try to encourage couples to think about that more and to make that part of their ongoing process.
Right.
What are we trying to do here? What does it mean to take care of each other?
Right.
And then what does it mean to take care of each other sexually?
Right.
What is that? What do you like? I mean, sometimes they don't even know what they like.
Well, the body shifts, the sexual energy body in your body shifts.
Well,
through
there are
different
some physical reasons for it,
Yeah.
but a lot of it is emotional. And there's been research to say that people who are older, and I mean 70, 80, they're doing a little research on 90s now because people are living longer and healthier.
Yeah.
They're finding that their sexual energy has not been lost at all. In fact, they may feel that they feel more sexual than they did when they were younger because they're freer and they're taking better care of their bodies and their health.
I think your energy, well, particularly with women, it increases when you get older.
Except for menopause. And we have to look at that.
Well, but that's
because-
just a phase. So if
Well,
you can get over that. And
yes.
so when couples are in that transition, how patient should the male be in that transition? What are some things to, help her get into her sensitive, sexy self? He's wanting to engage sexually, and she doesn't want to because the hormones are all wacko. So what kind of exercises can you bring into the relationship and help the man understand that this is what you need to do with the female body now for this period of time, and just so that she can get
Well, they have to
reacquainted?
figure it out together because every woman is different. But for those women who become very dry, they're going to have to ask friends, look online, find ways of how do I lubricate myself?
Right.
Because if you're hurting, you're not going to enjoy
Exactly.
the sexual activity. However, it would take a very sensitive man to have sex with you to get you past that moment.
Right.
Because once you get past that moment, then you start to feel who you really are. You really feel yourself. So that man is the man you want to have prior to that, who's sensitive, who's aware. You might not be feeling quite the same way.
And maybe part of the process is again, we talked about earlier, but talking about things.
Yeah.
Yeah.
Is talking to each other, maybe teaching each other, helping each other understand what happens inside both physically and emotionally.
Right.
So that you're both more aware of each other.
Communication's the
It
bridge,
take the
isn't
time.
it?
Yeah, it has to do with communication, but it has to do with a commitment to taking care of each other.
Right.
That, we're not there just to get off, so to speak. We're
Exactly.
there to really understand each other at a deeper level.
Right. I like this ritual. I like the word that you use because I believe in the Eastern philosophies of creating, sexuality in an intimate, ritualized. I think that is really important at this stage too, phase of the relationship, to set a ritual, and bring in other sensory elements and candles and longer periods of ceremonial, sacred play. I think that's highly important.
It could be helpful. I mean, anything is possible if you're both feeling on the same track.
Yeah, you have to be on the same
Yeah,
path.
and our focus is really to help people get that sense of purpose.
Right.
So sex is just another way that they're expressing their affection and their love for
Yeah.
each other.
But the intimacy is really highly important. Like just holding someone's hand.
Yeah.
Yes.
The
Yes.
eye gazing, like you mentioned, just
Eye
look and
Yeah.
reacquaint yourself with your partner's face and the contours of the
Exactly, just-
shoulder.
yeah.
And that's like intimate.
I mean, one of the exercises we do, is, as you're talking, reminds me of is we have partners look at each other.
Right.
And then we have one of the partners look at the other person's face and say, what do you see in the face? Where are the areas of stress, for example? Is it in the
Right.
mouth? Is it around the... Now do something to change that face.
Right.
So they have an experience of it by touching. They may touch and then suddenly they see the face lighten up
They
Wow.
can see it soften.
or softens.
you know?
Or
Yeah.
Wow.
So getting to know that you have the power to influence your partner in a way that's very subtle but
Yeah.
very powerful,
Yeah.
very deep, and getting to feel you can do that
Well,
is part of the process of.
I mean, touch is so nourishing.
Yeah.
I mean, you have to nourish the body and not just, I mean, that is going to create intimacy that's going to fold into, you know, the next intimate
Well,
phase.
it's the trust that comes with it.
Yeah.
So many clients will come to us and say, I just can't just go to bed with him. He never holds my hand. He never
Wow.
touches me. He never
That's
strokes
tragic.
me. It's tragic, but it happens a lot. And once
Why
that
does that
habit,
happen?
it's a good question.
Well, it has to do
What
with.
gets lost?
Well, it's not so much some things get lost, but it also has to do with what's called in psychology attachment styles. So some people are more, in their attachment style, they're more clingy. Other ones are more kind of withdrawn, and they just, not because there's anything wrong with them,
Right.
it's just the way they've learned how to adapt themselves to life. So they're more instead they just, you know, they could be very loving,
Yeah.
but they're more held back.
Right.
And so it's getting to know where your partner comes from and who they are.
You have to add those rich ingredients back into the
Well,
relationship.
to do it in a safe way.
Yeah.
So that if your partner, for example, tends to be more withdrawn than you,
Right.
you don't want to hit him over the head for it. You
No.
want to sort of find a way. How do you
Gently,
bring him back?
gently bring them back.
Yeah.
You know what, you guys, there's a lot to talk about with this topic. I love your work. I think it's fantastic. I mean, it's a place where I thought maybe my mother and father should have had when I was growing up.
We all should have
All
had
our
that.
mothers and fathers. should
Yeah,
have
and you
done
guys,
that.
I think it's great work. And it was nice having you on the show. And just keep on doing what you need to do to keep people together. It's awesome.
Thank you so much.
You're welcome. We'll be right back. Hi, welcome back to the show. And today's guest, Leanne Powell from the Sexual Health Unit. And we're going to be talking about promoting healthy sex. Welcome to the show, Leanne. Nice to have you here on this nice hot day.
It's lovely to be here.
Yeah, and so I can't do a sex talk show and host promoting healthy, intimate sex without having, you know, the precautions and taking into consideration that we need to be health-minded about it. So what do we need to be aware of with STIs?
Well, really, the thing to be aware of mostly with STIs is that anybody can get them, right? We often think that, no, it probably won't happen to me, or I really know my partner. But let's consider that most STIs have no symptoms.
Right.
So you might know your partner really well. Heck, they know themselves really well, but they might not know that they have an STI.
So an STI, okay, that's sexually transmitted infection.
Absolutely.
So it's changed from sexually transmitted disease. It's not a disease anymore?
No,
Or
it's
just-
not VD, it's not STD, it's STI now.
So it's an infection and it can be altered or cured or maintained or managed.
We can do something. Whether we can cure it or whether we can just try and abate symptoms and keep things under control, it depends on which STI we're
So
talking about.
what do we need to be aware of? You know, we're been married for 20 to 30 years and we've been in a monogamous relationship and all of a sudden we're single again. Somebody has passed away. We're back out into the single dating. How can we be sure? What things do we need to be aware of or consider to make sure that that partner that we're going to date, you want to have sex with them? I mean, what are we're going to have to wear a condom for the rest of our life?
And that's a choice that everybody has to make, because the reality is I can't give anybody any guarantees on anything.
Right.
Right? You can come in and get tested for STIs, which is really simple, painless, easy to do, but that result's only good that day, right? It takes a week to get the results in. So if you have 10 partners in that subsequent week, your results are going to come back, it's going to say you're fine, but who knows what's happened in the last week.
Right.
So I can't give anybody any guarantees about anything.
So let's say you've made a decision and you're both caring for each other. Can you go together and get the test done?
Absolutely. I think that's a great way to do it.
And what's involved with, do you have to like get undressed in front of the, you know, the doctor or whatever? Like, what do we have to do? Have something shoved up our vagina? Or would we have to, what?
Yeah, we're not that cozy typically. The reality is that testing is really painless and simple.
Right.
People come in, we'll talk to people about what the risk factors are. Then we can recommend what kind of testing would be appropriate.
Okay.
And if you're not sure and you just want to be tested for as many things as we can test you for, we're happy to do that. And the reality is most of our STIs, for some of them we test with a urine sample.
Right.
So all you have to do is pee in a bottle. I don't have to see you naked to pee in a bottle.
Right.
Right? Other STIs we test with blood.
Okay.
Some STIs we actually have to see a lump, bump, or a sore.
Right.
So in that case, would you need to get undressed? Potentially.
Right.
Right? But for the most part, it's not that bad.
How percentage proof are the tests? So let's say, oh yes, I finally got the results back, and he's good, I'm good, and it's okay to have sex without a condom. I mean, I would be worried about that personally.
There are some STIs that are transmitted by skin-to-skin contact.
And sometimes they're
Herpes and warts are transmitted through skin-to-skin contact. So
Right.
even if you're wearing a condom,
right.
unless you're wearing a latex boxer short, there's no guarantee. Right? But we take chances every day of our lives.
Yeah.
Whether it's crossing the street against the light or
Yeah.
just, lots of things we take chances on. So it's a calculated risk.
Right.
You do the best you can to keep yourself healthy
Right.
by getting tested on a regular basis,
Yeah.
getting tested before you have sex with somebody, but then you take a chance.
So interesting. So on a regular basis, how often should you be tested? Let's say if you have open relationship with your partner, and let's say you have another significant other than your primary.
Right.
You don't know what they're doing.
Nope.
Maybe you might know what your primary is doing, but so how often should you be tested, just in case?
Right.
Even though you were good the first time with your primary.
Who knows now?
once a month, every 3 months, every year.
It's going to depend on the person and what the risk factors are. Right? So if you're having unprotected sex with other partners on a regular basis, if you're having a new partner every week, I'd say come on and get tested every week. Right? Every time that there's a chance you could have something,
Right.
come on in and get tested. We don't have a limit. There's no quota system. You can come as often as you need to.
Can you come anonymously?
Can you come anonymously? You can come and you can give whatever name you want.
Right.
For our STI clinic, it's drop in, first come, first serve.
Right.
Don't need a health card. Most testing and treatment is free. You show up, you give them a name. Don't care what name.
Right.
So you can come in and do that. And that being said, when you come back to get your results, because we want people to come back and get your results, we're not going to give them over the phone because anybody could say that they're you.
Right.
So come on in, but remember who you were when you came for your testing,
Yeah,
right?
right.
Because if you turn into somebody else, you're not going to get your results.
You had 3 names going.
That's right.
3 different places. You're doing the rotation. So with that said, when I'm in there, what is the procedure? Do I wear a smock or something?
No, you come into
What's the atmosphere like? Is it like really clinical or?
It's kind of clinical.
I've never been in one.
Sure, you walk into our waiting room, we have TVs going because people are really protective of their privacy and people don't want to look at other people at STI clinic. You tend to look at yourself, you're looking at your phone, you're doing that kind of thing. Really, but I think it's awesome when people come for testing.
Right.
It shows me that they care about themselves and they're taking good care of themselves and their partners.
Yep.
So I don't want people to be embarrassed to come. I want them to celebrate the fact that they're smart enough to get to us.
So is there a misconception in some people's eyes when they think about a sexual health promotion outlet, like where you are? And what did the mass population normally think about? Is like there's just going to be all disease oriented. I'm going in there because I have an infection, or what's the perception out there?
I think sometimes I think the perception is people don't want to be judged.
Right.
People know that it's great to get tested, but they don't want to be judged by other people who are there who might be thinking that they might have an STI, right? So it's about the whole judgment and the stigma of getting tested. Getting tested is smart. I don't care how you slice it or dice it.
So can you still have a healthy sexual relationship if you have an infection? It depends on what infection you have.
Sure, and there are some things that you're going to have for life. And can you still have a great sex life? Absolutely.
Right.
You have to know how to manage your illness and what the best way to do it safely is. So really it's about taking good care of yourself, making sure you're healthy, taking any medications that the doctor suggests that you take. And it's about knowing what the risks are.
Right. I wonder if there's, with all of, STIs and knowing that they're out there, I've heard from a lot of people, couples, who don't want to even take a risk, so they end up being still with their partner sexually after they've gone off. I see a lot of that. I mean, that's okay. Sometimes it even brings them back together again.
Potentially.
Yeah.
And that's the great thing about our clinic is you can come in You could be a sex trade worker.
Right.
You could be monogamous with one partner for 20 years. You could have multiple partners. You could be in same-sex relationships. You could have whatever sexual orientation, gender identity that you have,
Yeah.
and you're going to be welcome at our clinic with
Yeah.
no judgment.
Yeah, that's the way it should be. And I think don't be afraid to know that it's just a normal thing. I mean, things are just airborne. They're, viruses are. What about cleanliness? Do people get? There's other people that have gone in with infections and
Yes.
stuff. So what about that concept and thinking in my mind? I don't know if I want to even go. Like how clean is it going to be when I'm there at the clinic?
We're pretty clean. And the reality is, okay, I've worked at the clinic for over 10 years. I use the bathroom that everybody else uses. I don't have a special staff bathroom that we use.
Right.
We use the same bathroom that everybody, I will go to the bathroom in the middle of an STI clinic
Right.
because you're not going to get something off the toilet
Right.
seat.
Yeah, of course.
Right? But that's the thing that people worry about.
Yeah, they
Toilet
do.
seats are
It's
safe.
like it's a different.
If they're filthy dirty, don't sit on them because you could get something
Obviously.
else. But yeah, I'm not worried about STIs.
Young people and related to older people, do you see like a balance?
We see more young people than we see older people,
Do you?
but do we see older people? Absolutely. Are they welcome at our clinic? Anytime.
There's some people that find out years after that they
Yeah.
do have an infection, and they're like just flabbergasted because, oh my God, I thought I was in a monogamous relationship. And like, is there like an emotional kind of, it's okay, it's not your fault, we can, help cure it or whatever.
Yep.
It's like, can be a really overwhelming shock to find out that you've got an infection from somebody you've been with for like 20 years. So how do you deal with that when you're giving the news to them?
It's an overwhelming shock for anybody to find out they have an STI because nobody thinks they're going to have one.
Right.
We have lots of them, but people don't think it's going to happen to them. The reality is, some of them, like really, I'll give you antibiotics, it'll go away. It's no worse than strep throat.
Right.
Like really, you need to keep it in perspective.
Right.
And normalize it that lots of people have this. If it's curable, we'll tell you if it's curable. If it's treatable, we'll tell you how to treat it.
Yeah.
So it doesn't have to be overwhelming, but I think sometimes the initial shock can be.
Yeah, I mean, if you just think of it as they're there and they have to accept it, and if it's not deadly and it's not going to kill you,
Yep.
it's just an infection,
Yep.
like anything else, then that's
But then there's the whole
awareness.
relationship component.
Yeah.
Like if you're looking at, I've been in a long-term monogamous relationship, how did I end up with this? And you've
Right.
got that whole relationship issue to deal with as well, which I think sometimes plays into it.
Right. Well, I mean, I think it's very important to be aware of all this, especially when the sexual evolution is happening. It's like everyone's having sex again. It's like it's okay to go out and explore and have sex. Great work you do. I love it. I think it's important to keep people aware that it's all good and that you're there for support, supporting them. It's great having you on the show.
Thank you very much.
Great. We'll be right back. Thanks for watching the show today. It was great having my three guests on, David and Louise and Leanne. And if you have any questions about any of the topics we discussed, feel free to email me at sexwithdrzen@gmail.com. We'll see you next time.